Plastic surgery has become increasingly popular, but despite that, there's not much diversity within the profession. We spoke with President-elect of the American Society of Plastic Surgeons, Dr. Stephen Williams, about why pushing for more diversity in plastic surgery is crucial. Watch. Dr. Williams, welcome to Inside South Florida. It's great to see you.
Thank you very much for having me.
When you think about plastic surgery, the last thing that comes to mind is diversity, right? The importance of diversity in the field of plastic surgery. Expound upon that for us, please.
Yeah, so that's probably part of the problem. I think we really need to think about things in a more expansive way. I think the first thing to recognize is that plastic surgery is more than the cosmetic aspects of it. It can include cancer reconstruction, breast reconstruction, hand surgery, nerve surgery, a wide range of procedures. And so when we think about diversity in plastic surgery, we're really thinking about diversity in healthcare.
Being able, doctor, to identify with your physician, that's important.
Yeah, it's critical. And I think you raise a really good point. If a patient can't feel comfortable communicating with their physician, if there are barriers to expressing what their concerns are, what their desires are, what it's like at home in terms of postoperative care, or barriers that might help them from getting better, they're going to get inferior care. And when we're thinking about what's really important, patient care has to be the first thing that comes to our mind. And so when we think about the value of diversity, it's being able to form that connection with your healthcare provider. Now, it doesn't mean that a patient has to look like their healthcare provider or a healthcare provider has to look like their patient, but we have to have a diversity of perspective and understand diverse experiences to be effective healthcare providers.
Obstacles, Dr. Williams, patients face of varying ethnicities when it comes to plastic surgery care. What's being done to address those challenges?
So it's a great question. There have been several barriers that have been in place for people of ethnic minorities or people who have are not on the upside of the economic scale. All of those things really have impaired people's healthcare. And I think things are getting better, but part of what's making it better is our ability to listen to patients, our ability to understand patients' histories and the history of the United States, and really putting that perspective into our interactions with patients so that we can provide the best care.
President-elect of the American Society of Plastic Surgeons, Dr. Stephen Williams, you are a gem. Where can we go for more information?
You can find out details about plastic surgery at our website at trivalleyplasticsurgery.com. There are a lot of great resources online, but the main thing is make sure that your voice is heard, make sure that your care providers are listening to your perspectives and your concerns.
Brilliant, doctor. Dr. Stephen Williams, thank you so much.
Thanks for your time. I appreciate it.